Okay, Karen Black. Any suggestions for husband's high blood pressure at night? Keto for nearly 2 years. We use Omega or Omron. I think you meant Omron, Omron, blood pressure machine. It takes an average of 3 readings. He takes multiple readings a day. Well, the vast majority of high blood pressure that you see are related to and responsive to 2 things. One is aging. As we get older, we tend to get hypertensive. Just like as we get older, we tend to get pre-diabetic, lose our ability to metabolize carbs. Now, there's not much you can do about that. However, there is something you can do about high blood pressure in most cases. The vast majority of cases that I've seen were also very sensitive to being overweight. I have it. Nobody would consider me to be overweight. Most folks wouldn't. Anyway, I've got a BMI around, it varies between 21, 22. If I gain 5 pounds, my blood pressure goes up. If I lose 5 pounds, my blood pressure goes back down. And this is not about me. I'm sharing my own story, but it's to make this point that I've seen very few people, including people that have a BMI at 21 and 22, which is not that common, who don't respond very well to loss of weight. It's that same old thing. Now, there's a whole bunch of stuff about blood pressure. Up until COVID-19, my go-to medications were in the ACE receptors. Obviously, a boatload of discussion about ACE receptor medications, the ACE inhibitors and the ARBs, regarding blood pressure for this specific time period. Bottom line is, people that are on it, including myself, do not recommend, neither myself nor dozens of other standards committees that have taken a deep dive into this issue. None of us are recommending that people get off of their ACE inhibitors or ARBs. Now, the one question is for people that are newly diagnosed with blood pressure, and I've had a few over the past month, and given that information, we're not starting people right out of the blocks on blood pressure treatment with ACEs and ARBs, usually with a calcium channel blocker. I had a patient actually yesterday that we were talking about this, and he was saying, oh no, I don't want to take those beta blockers. I've had them before. Beta blockers and calcium channel blockers are 2 totally different types of medications. And most of us, as we continue to get older, we continue to go down that path of getting worse and worse blood pressure, just like we continue to go down that path of getting more and more insulin resistant. As that happens with our blood pressure, we start off, for example, quite often being managed very well with one type of blood pressure medicine. Again, usually ACE inhibitors or ARBs, for me at least, and for, again, more and more docs. As we get older, the blood pressure continues to get worse. We usually, sooner or later, need to add a second type of medication. So again, for me, it was usually starting off with an ACE or ARB. As the patient continued to age into needing a second line, then go to calcium channel blockers. We've reversed that now, where we say, look, if you're getting started now, you need to go into calcium channel blockers first. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.